Hello, everyone. My name is Erin Lashnitz. I teach one of the endocrine modules on Obi Vet, and I wanted today to give a quick update on some of the more recent literature on hyperadrenocorticism in dogs over the past couple of years. So this quick video will just focus on some of the papers that have been published on the pathophysiology and presentation of Cushing's in dogs over the past couple of years. First, getting at some of the literature that has focused on the pathophys of Cushing's, there was a case report that came out in 2021 that showed that there was a dog that developed Cushing's secondary to ACTH secretion, not from a pituitary tumor, but rather due to ectopic secretion of ACTH within the adrenal cortex mediated by nodular adrenal hyperplasia. This seems to be a very rare occurrence, but it is something to keep in mind if you're seeing a dog that seems like they have an ACTH-mediated Cushing's, but really no other signs of PDH and rather adrenal hyperplasia. There was also a review published in 2021 just going over different types of pituitary tumors in dogs and cats. This is a useful review just to start to think about the underlying tumors that occur with PDH. One focus of the literature recently has been on the underlying pathophysiology of atypical hyperadrenocorticism or atypical Cushing's. Just to remind you, this is the syndrome where we see dogs that present with clinical signs that really look like Cushing's, but their Cushing's screening tests are actually normal. So they have normal stim and they have normal low-dose dex. And so one of the theories is that this is due to excess precursor hormones to cortisol synthesis rather than cortisol itself. So a paper came out in 2021 that looked at these precursor hormones in dogs with hyperadrenocorticism compared to normal dogs. And they did find that there were higher concentrations of a handful of these hormones in dogs with Cushing's at baseline compared to normal dogs, and then also higher levels of some of these hormones after ACTH stim in dogs with Cushing's compared to normal dogs. So that would support this theory that some subset of dogs with atypical Cushing's is because of excess precursor hormones. Now, when it comes to presenting signs or presenting complaints of dogs with Cushing's, this has been the subject of a lot of literature recently, particularly these large epidemiology studies. So one of these came out in 2022, looking at over 900,000 dogs from UK general practices. And this basically showed that because it looked at dogs presenting for newly diagnosed Cushing's over the course of a year, they were able to determine not just the prevalence at about 0.2%, but also the incidence of Cushing's. This study did confirm some of our previously known sort of risk factors when it comes to signalment. We know that Cushing's is a disease of older dogs, and so the average age of dogs newly diagnosed with Cushing's in this study was 11 years. It also identified a handful of breeds at higher risk, which fit with what we sort of previously know. Interestingly, in this study, it did sort of confirm that the sex predilection that we previously thought might be the case, thinking that female spayed dogs are more likely to develop Cushing's. This sex effect actually seems to be more of a confounding effect with age. So female spayed dogs are likely to live the longest, and therefore, on average, they live long enough to develop Cushing's more often. So actually, when you take away the effect of age, there was no sex predilection for the development of Cushing's or the diagnosis of Cushing's. And you can see in the top right-hand corner here, image from this paper, which shows kind of the risk of new diagnosis of Cushing's at any given age of dog. So you can see that risk goes up pretty quickly until you hit that 7, 8, 9-year-old age, at which point you are at risk. It doesn't keep going up that much faster as you get older. Now, when it comes to clinical signs of Cushing's in dogs, there are a handful that recent literature have addressed. So this paper looked at the underlying drivers of some of the muscle weakness and cachexia we see in dogs with Cushing's. And this was actually an experimental study looking at what happened to dogs' muscle volume when given prednisone, and found that After 4 weeks of prednisone, dogs did develop significant muscle atrophy as measured when you looked at imaging. Another clinical sign that we know is common in dogs with Cushing's is hypertension. Now, previous prevalence estimates were super wide, anywhere from 30 to 85%. And so a recent paper actually sort of tried to define this a little bit more closely. This was a fairly small group of dogs, only about 60 dogs with hyperadrenocorticism, but they found that about 80% of these dogs had moderate hypertension, so between 150 and 180, or excuse me, higher than 150, and then 50% of those dogs had blood pressure in the severe hypertension category, so higher than 180. A follow-up study to this from 2021 then looked at what happens to hypertension in these dogs once their Cushing's is treated. So this took a subset of these dogs that had PDH, and they followed them over a year's worth of treatment. And so initially, about 60% of these dogs were started on benazepril for hypertension. About 60% of those dogs did not need another drug after starting benazepril, so they did not need to escalate their antihypertensive medications once they started treatment for their PDH. However, they also found that about a third of the dogs that were initially not hypertensive actually went on to develop hypertension during that 1-year follow-up period, despite being treated for their PDH. Finally, they found that no dogs were able to decrease their blood pressure medication. And so all of this would indicate that basically, even if you diagnose and treat the Cushing's, you still have to continue to monitor for hypertension because they may need to stay on their blood pressure medication and they can newly develop hypertension despite treating the Cushing's. Then we also know that hypercoagulability is associated with Cushing's disease. There has been one new case report that came out in 2021 looking at an arterial thrombus in a dog with Cushing's. And then one other paper that came out in 2021 that looked at some of the underlying sort of drivers of hypercoagulability in dogs using the thrombin generation assay and other different types of hemostatic factors. Then finally, we can talk about calcium phosphorus regulation in dogs with Cushing's. And we know that compared to healthy dogs, dogs with Cushing's have similar total and ionized calcium, indicating effective compensation by PDH despite a higher phosphorus, as well as a higher PTH. So we also know that this higher PTH, higher phosphorus, and normal ionized and total calcium is associated with higher urinary loss of calcium, which drives the risk for calcium-containing uroliths in dogs with Cushing's. And so this is all summed up by this syndrome that's been more recently defined as adrenal secondary hyperparathyroidism, where they're hypercalciuric but actually have a normal total calcium and ionized calcium with a high PTH. That wraps up the summary of some of the more recent papers over the past couple of years on the pathophysiology and clinical signs and presenting complaints of dogs with Cushing's. And if you're interested in learning more, certainly check out the Obi Vet module on hyperadrenocorticism in dogs. Thanks very much.